Hello. Yeah. So I'm here doing research on AI for a year, originally from Korea, vascular surgeon. So that's why I've been given this talk. I'm not like an expert on AI, but I want to focus on the clinical applicability of AI in vascular surgery, and especially in vascular imaging. So AI can be defined as the capability of a machine to imitate intelligent human behavior. And in this broad spectrum of AI is a discipline known as machine learning, where it has the ability to automatically learn and improve from experience, either in a supervised or an unsupervised fashion. So there's an explosion of AI right now, especially in the last decade, and it's continuously being integrated into our daily lives. But it is important to understand what are the strengths and the limitations of AI so that we can apply it correctly. So my first impression, or when I first became aware of AI, was when there was this so-called human versus machine challenge between former Russian chess player Kasparov and IBM's Deep Blue. This was in the mid-1990s, and we were all shocked by the fact that Kasparov lost to this IBM's Deep Blue. So after that, technology has advanced, and in 2016, there was in this game of Go, which is a more complex game than chess because it has more possible moves in the order of 10 to the power of 360, which is virtual infinity. And there's the Korean player, Lee Sedol, against AlphaGo from Google. And Sedol Lee won only one of the five matches. And this was the only match that actually won against AlphaGo. After that, it has been undefeated. So right now, it's in these kind of repetitive strategies, it's hard for humans to win a computer. What about cars? Now we have self-driving cars with different levels of autonomy. And some of these cars are already running in our cities, like in San Francisco, where we have these taxis. But if we expect of AI as like a robot being able to think or act as a human, then there's still a long way to go. Because in reality, our current robots are very primitive. And this is because they do not have the self-awareness properties that are required to act as a human. So what is the role of AI? It has the ability to analyze large amounts of data, recognize patterns, predict outcomes, and draw conclusions to improve our workflow. So what would be the goals of AI, especially in healthcare? It would be to use the information efficiently beyond human processing capabilities to decrease our cognitive load, to expand patient-centered treatment options, and to improve patient outcomes. So how can we apply this into vascular surgery? We can use it for vascular diagnosing, for perioperative medicine and risk stratification, and also for outcome prediction. So in this algorithm, for a patient who would typically undergo EVAR, from preoperative to postoperative surveillance, all these green boxes show where we can apply AI at the different steps of the patient treatment strategy. So utilization of AI in vascular surgery is increasing, as shown by the number of publications that is continuously being increased in the recent years. But if we compare this to other specialties, such as neurology or oncology, we're still far behind. So now I'd like to focus on especially vascular imaging, and since this is an aortic session, I would like to focus on the aortic diseases. So we can use AI for the detection of aortic aneurysms, and this report shows an automated way of segmenting these images so we can detect these AAAs without the input of humans. So what it does is that it detects the aortic contour, the aortic lumen, the intraluminal thrombus, and even wall calcifications. And all this is done without any human input, so we do not need to tell the machine, this is the aorta, and from where you have to start segmenting. It will all do it fully automated fashion. So this is how the algorithm works. When the machine gets the image, it first undergoes a pre-processing stage where it modifies or adjusts the windows and the levels, and it removes all the noise to improve the quality of the scans. And then it goes lumen segmentation by methods known as the active contour method or the border propagation method. And based on this algorithm, it will repeatedly undergo this process until it refines its segmentation and it finally arrives at a stop. So this is what you would get. This is the automated, this is the manual segmentation. The red shows the lumen, the green shows the intraluminal thrombus, and you can see that there's virtually no difference between what these two have shown. And on 3D reconstruction, you can see the lumen in red, the thrombus on yellow, and then this is a map of the calcifications along the aortic wall, and you can see that it's very, very nice. And all this is done in with a computational time of less than 1 minute per patient. So if you're dealing with thousands, 10,000s of scans, then it's much faster than what man can do. You probably all heard about AI Doc. It's an AI operating system that is integrated into our hospital's system. So what it does is on CT scans, it can actually detect certain diseases, for example, aneurysms or dissections, as well as VT and other specialties. But so once we have a CT scan, it will detect it automatically, and not only the diagnosing, but after that, it will also initiate a treatment protocol. So what it does is it will allow the care team to know that there is this kind of aneurysm or dissection, and if it's an urgent case, it will also activate an acute care protocol. And not only there, but so it provides a comprehensive approach to the patient from diagnosing to treatment and also to the long-term follow-up. So this is how its flow works. So when it detects an aneurysm, it will decide the disposition of the patient, whether this is an acute or an urgent case, or if it's a small aneurysm, it will just make it follow up. But with small aneurysms, there's always the issue of patients being lost to follow up. So this protocol will ensure that those patients are not lost to follow up. What are the other applications of AI? We can use it to characterize AAA geometry, especially for automated sizing for our case plannings for EVAR. Also, it can predict AAA growth and also predict rupture risk, especially in combination with computational fluid dynamics or other data, such as the biological or demographic factors of the patient. We'll all combine it to predict rupture risk. Also, it can be used for intraoperative guidance, fusion imaging, and also it can predict post-EVAR failure, which patients from their anatomy or certain features will undergo post-EVAR failure. Also, it will allow us to detect endoleaks probably better than the human eye. So these are all the possible applications. This French company, Incepto, has been using this AI technology to measure the diameter of the aorta at different segments and base these to use for planning during EVAR procedures. Also, CIDR has been using this navigation technology, and probably our next speaker is going to be talking more about this. So in terms of accuracy, all these reports are showing us an accuracy of around 80 to 90% or even higher. For example, in studies where they measure wall thickness or volume measurement, they all achieved at least 85-90% accuracy, and with a computational time for segmentation much shorter than when it is done manually. Another study also showed that when we predict growth of AAAs, it was able to accurately predict AAA diameter within a 2 millimeter error in 85% of the patients at 12 months and 71% of patients at 24 months respectively. So despite these possible applications, there are always limitations. This is not only vascular, but it also has to do with general AI in healthcare. It has to do with the quality and the heterogeneity of the data, the lack of standardization. Also, the problem of having to externally validate these results, the fact that we do not actually know the causal relationship between what the machine learning has told us, and also how we can apply this generally to the patients. The clinical applicability and the end user friendliness is also an issue. Ethical issues are always there, with data privacy and security issues there, and also the cost to implement these kind of algorithms and systems into our practice is also an issue. So in summary, considering the heavy dependency of vascular surgery on imaging, AI can be a powerful tool to implement in our daily clinical practice. And although it is still in a relatively primitive form, AI can continue to evolve, leading to improved patient care. So it is important to understand the current position and limitations of AI to meet the goals and succeed with AI application. Thank you for your attention.